and welcome. You are watching The Island Docs. I am Dr. Sandy and this is my co-host, Dr. Gordon, and we're here to talk all things health and health related. Today our topic is addiction. Addiction affects so many families in the Caribbean and all over the world. Each family probably has at least one member who is battling with some form of addiction or the other.
Yes, correct. So what exactly is addiction?
Now, addiction is a maladaptive behavior that you're doing, even though you know that it is causing you any sort of physical harm.
So really, can you be addicted to anything?
Yeah, I think so.
So what about sweeping the floor? Can you be addicted to that?
Yes, actually, if sweeping the floor prevents you from going to work and it's all you can think about when the day comes and you need to sweep the floor every minute of the day and that's the only thing that brings you joy, these are all the things that, yes, I guess anything like sweeping up the floor can be an addiction. But there's the DSM-4 criteria that we use, and you have to have at least 3 of the symptoms. And one of them is called tolerance. And tolerance is when the same amount of the drug doesn't have the same effect on you, or you need to take more of it in order to have the same boosting effect.
Right. So if you notice people who are alcoholic initially when they started off, they started off as drinking a few beers.
Yes.
And then as time progresses, they need more and more alcohol to have the same type of nice feeling.
Yes, exactly. And then another symptom or another one of the DSM-4 criteria that you would probably have would be that you are having problems with withdrawal symptoms. So let's say, for instance, that you decide that you're going to stop drinking or you're going to stop smoking. Then when you stop it, you're having anxiety, you're having palpitations, you're just not feeling your regular self. So you're having withdrawal symptoms associated with the drug.
Yeah, well, especially with drugs, which make some kind of chemical barriers in your, form some chemical dependency in your brain so that without having it, you do experience actually physical signs and symptoms of going through withdrawal.
Okay, and the next one would be if you have actually tried to cut down and was unsuccessful. So if you have tried to quit in the past and you were not successful at quitting at whatever it is, it could be smoking, it could be drinking, it could be the use of cocaine, it could be the use of marijuana, and you have not been successful, then this is one of the other criteria as well.
Yeah, because if you're taking a drug and you know that things aren't going well, then, and you've tried, you've actually made an effort, you've spoken to your family, people have told you about it, and you have made an effort to try and cut down and drink less, smoke less, and have been unable to do so, then that's one of the DSM criteria for addiction.
Yeah, another DSM criteria would be, in fact, if you're spending a lot of time consumed around this event. So we see in the hospital so many times that we have drug seekers and they're spending a lot of time from hospital to hospital trying to get, all these different medications, or you're spending a lot of time on the streets because you need to get cocaine, or you're spending just an excessive amount of time devoted to this activity. That's another DSM criteria.
Yeah, and the final DSM criteria is when the want for your drug or your addiction of choice starts encompassing all other areas of your life. You start feeling sad, you start having problems with your family tell you about it, but all you need to do is take all your effort and try to get that drug, and it causes things around you to start falling apart.
Yeah, sometimes you even decide not to go to work or, not to go to family events. You're just becoming more and more isolated. So, on the internet, there are some questionnaires that you can use to test to see if you are in fact addicted to different, products or anything out there, because addiction doesn't only include drugs. It can be something like you can be a sex addict, you can be addicted to plastic surgery. I think on TLC one day they had that show where the lady was addicted to getting Botox injections in her butt. Somebody else was addicted to, sniffing diapers. So literally addiction could be a large spectrum.
Final thing we want to talk about in addiction is when you are aware that it's causing you so much harm and you're just unable to help yourself.
Exactly, like it would be an alcoholic knowing that he has liver cirrhosis as a result of it. He's been told about it. He knows that he's having all the symptoms of liver cirrhosis, and yet he still needs to have that bottle of alcohol.
Right, so when you put any of those 3 or more things together, then that actually points in the direction of having an addiction.
Addiction is something that doesn't only affect the person, but can also affect your family, your friends, your close-knit group around you, right?
Yeah, I mean, when the person who's the breadwinner becomes addicted to some type of drug, then it puts a serious financial strain on the family.
I mean, you think about it. If your mom or dad, who is supposed to be contributing to the finances, is drinking or smoking and can't do her,
Or
work,
function, yes.
yeah, then that's part of the money coming in towards the house not there anymore.
Especially when that person starts using all of their effort and resources to try and drug seek or try to
Like even casinos, like sometimes people are addicted to gambling and stuff like that as well. That puts a financial constraint on your family. Also, like that could also lead to child abuse, spousal abuse. You're thinking about medications, or you're thinking about alcohol, and you're drunk. You come home and you beat your wife, you beat your kids because you're in that state of mind, right?
yes, correct. So there's child abuse, elder abuse, spousal abuse. Yeah, and I mean, addiction can even really, really cause you to do some illegal activities because if you're siphoning your finances that should be provided for your family to support your habit, then it leads to, financial ruin.
Yeah, definitely. And so many times you hear about, people stealing from their family and their friends and their loved ones, and then even moving on to stealing from strangers.
Yeah, I mean, when you are unaddicted to something, you engage in reckless behavior.
Drinking and driving.
Yeah, you're doing all sorts of things that, might be illegal.
Definitely. And also, another thing that can happen is that so many families get frustrated after dealing so many months with this person. They're not changing, they can't afford to fund them anymore, and they kick them out of the houses. And then that results with them, being homeless on the streets.
Yeah, and when you're homeless, you're not a productive member of society. Again, homelessness, dealing with crime, because now you're trying to see if you can find money. So, I mean, it's a vicious cycle that really, really affects society. We're going to take a break now, but when we come back, we will continue on addiction, where we will discuss smoking, cocaine, and
Alcohol.
alcohol.
See you after the break.